Hey, Dr. Ian here from Dr. Autoimmune. Hey, welcome to our Healing Your Thyroid and Changing Your Life webinar. This is not going to be a normal webinar. This is not going to be a commentary on, again, what the thyroid is. And this is hopefully not going to be boring. So for the past 16 years, I have been pursuing something called functional medicine. Not only do I have a master's in it, not only do I have an additional certification in it, but we have been in the trenches with clients for 16 years, showing them exactly why they have inflammation, why they have symptoms, and why the insurance, drug, and disease model no longer works. So my story basically is, and how I got into this was, well, essentially, I was sick, and I became sick in my grad school program, my doctorate program. And what happened was I started seeing providers. Of course, you want to get better, you want to feel better. I had brain fog, I had terrible anxiety, I had insomnia, my gut was a mess. I was falling apart. And so I was really worried, I was concerned, and honestly, I've been dealing with issues off and on in my life, but everything really kind of came to a head. Well, I was going through grad school, and if you're aware about that, it's terrible nutrition, it's high caffeine, it's many hours, right, inside school, outside school, and basically I stopped taking care of myself. Well, at that point, right, I started to seek information, seek knowledge, and I went to doctors. Doctors are the one who's supposed to be able to tell us what's wrong with us. So I had lab tests done, imaging done, and I literally went to 8 different doctors. And no one could really figure out what was wrong with me. Does this sound familiar? It should sound familiar. And so people tried things, supplements, they tried to adjust me. I did creams, I did lotions, I changed my diet, and no one actually really sat me down and said, hey, after my analysis, after my labs, here's exactly what's wrong with you. And that's the amazing thing about what functional medicine can do, and what we're going to talk about what you're currently missing as far as in your healthcare. So again, instead of going to doctors that just named it, blamed it, and tamed it with a drug, or tell me and gaslight me and tell me that I had depression or anxiety and I needed to take this drug to be healthy, right? Which is a crock. It's really take this drug to decrease the symptoms. This functional medicine provider actually sat me down, explained what was wrong with my physiology, told me how to correct the issues, tracked my progress over time, and he became the inspiration of why I'm doing what I'm doing right now. So you guys have your own reasons as far as why you're listening to this. You might be fatigued, you might have brain fog, you might have been told that you have a high TSH, you're scared of taking something like levothyroxine, which is one of the #1 medications prescribed in the country right now. But what you're going to get by the end of this webinar is a deeper understanding of the fundamental principles of what causes thyroid dysfunction. And instead of just trying to, again, put lipstick on the pig, or trying to, again, put a blanket over the problem, we're going to dive you deeper into the reasons why. If at that point you say, you know what, this guy maybe sounds like he knows what he's talking about. And we've again seen over 2,500 cases of thyroid disease in my practice. I've seen about 5,000 clients, literally half of those clients, and the #1 client that still comes in to consult with us is a thyroid client. So in 2012, and then in 2013, and then in 2014, right, I was involved in a award-winning documentary. That's actually called The Thyroid Secret. And the person who's actually on this her name is Isabella Wentz, or the thyroid pharmacist. So I got involved in a, again, award-winning documentary where I was featured as one of 100 experts that were interviewed on the most cutting-edge and leading topics. And one of the main reasons why they actually sought me out was because I was already building many thyroid cases into my practice. They went and found my Google reviews and they said, we probably need to get this guy on our documentary because he has a ton of patients he's already shown how to heal. So we aligned together, and again, from there it's kind of just amazing, because now people all over the world have been actually seeking our care as it relates specifically to thyroid disease, Hashimoto's, Graves'. And again, but what's most important is that we are the investigators of why people have the issues that they have. We are not here to just give you the latest and greatest supplement or medication or endorse a treatment. What we need to do is actually fundamentally tell you how to change your life and address the inflammatory issues that are causing your symptoms. So again, different ways that you probably got here, but one of those may be that you had this TSH test, that's thyroid stimulating hormone, and that test is actually a pituitary marker. It is not a thyroid marker. And what happens is you have this large range, usually 0.4 to 4.6, and if you fall outside of that, on the low side, you're hyper, and if you fall outside of that on the high side, right, you're hypo. And so you either have a high TSH, hypo, because you're not producing enough thyroid hormones, or you have a hyper, meaning a suppressed TSH, because you're producing too much thyroid hormones. Now, almost 100% of this is Graves, and there are, again, few examples of something called thyroiditis. Most commonly associated with actually postpartum or during pregnancy. Now, the vast majority of people dealing with thyroid disease are actually hypothyroid. So again, the classic symptoms that most people are complaining about, they're fatigued, they're brain fog, they're cold, they can't seem to manage their weight even on a low-calorie diet. They might have swelling, difficulty swallowing, voices deepening, right, getting scratchy. Or hey, your hair is falling out, hair quality is suffering, dry skin. Are any of these symptoms sounding familiar? I think so, right? Your nails are brittle, you got ridges on your nails. And really, typically, one of the worst symptoms that people have is anxiety and terrible quality of sleep. So we have all of these associated symptoms, and if you're lucky enough to get flagged with a high TSH, your doctor rolls out the prescription pad. And they say, okay, Susie, you're going to get levothyroxine. And you're like, what is that? Well, it's a thyroid medication. Okay, so usually when you take a medication, you're taking that medication to increase an enzyme, decrease an enzyme. You take a blood pressure medication, you're trying to get your blood pressure to go down. But what they're not telling you is that thyroid replacement is hormone replacement. And levothyroxine, Tyrosint, Levoxyl, Armour, Nature-Throid, WP Armour, Cytomel, they are all hormone replacement. We call that HRT. So the first thing you need to understand is that the thyroid medication that they're giving you is actually not treating your thyroid. By definition, it is hormone replacement. And you might think that that's just semantics, but it really isn't. Because here's what happens. You're a good patient. You take your levothyroxine, which 30% of people actually cause an increase in symptoms. You might get more constipated after taking levothyroxine. You might notice more heart trembling when you take levothyroxine. So you're going to be a good patient, a good sport. Hey, insurance is covering this. So let's go ahead and take that thyroid medication and see what happens. Well, guess what? The TSH number improves and you're still left with symptoms. And now it's like, well, what do we do now? Oh, now we need a specialist. Now you need an endocrinologist. Now you need a dermatologist for your dry skin. Now, right, you need they're going to get you, what else? They'll get you a psychiatrist, right? Because you've got anxiety and depression. So they start basically farming you out to other providers. And again, in the back of your head, and this is what I knew this to be true for myself. And I've seen this thousands of times, over and over again for the past 16 years. Something is missing. I knew that in my soul. And I knew that I could heal, but I needed to find the right person with the right skill set to figure out why I had those issues. And that's what functional medicine is. It is about getting into the root cause. So again, we've got this scenario where they'll use these medications, and this will be conveniently covered by, again, your insurance. But what happens is you're left holding the bag. You're left with residual problems. You're left still battling with prediabetes. You're left with tingling and numbness in your fingers. You're left feeling just foggy and fatigued all the time. And there's got to be more. And I'm telling you, there is more. But you're going to have to start asking better questions. Why do I have this? What could I do different? Is my diet involved? Because if you go and you talk to these specialists and these doctors and you ask them the basic question, hey, should I avoid gluten? Hey, do I take iodine? Hey, could my adrenal glands be involved in here? They will have no clue. They will usually, again, actually tell you that has nothing to do with it. And before you know it, in a couple minutes, they're out the door and you're not going to get a hold of them. So that is a sad and sorry state of affairs in our current medical system. And again, unfortunately, it's failed most of my clients. And I love other doctors and I love their dedication and the sacrifice that they gave to be who they are. But again, in my opinion, medicine is about acute and emergency. And it's not about the chronic mechanism of why you have this. So to go back, right, when you have a high TSH, we know that 90%, meaning 9 out of 10 people actually have a condition called Hashimoto's. Okay? That was discovered in 1912 by Dr. Hashimoto's, right? And so guess what he found? He found inflammation of white blood cells, these white blood cells on the thyroid gland. Right now, Hashimoto's is the #1 autoimmune disease in the world. It is the #1 autoimmune disease in the country. And when you have Hashimoto's, you have a 50% chance of having a second autoimmune disease. Many of you guys listen to this. You already have a diagnosis of RA or MS or celiac disease or lupus or Sjogren's. And you're wondering, again, well, what's next? Because I also have these symptoms. So are these symptoms meaning that I'm gonna have another disease? Or you've tried drugs like Humira or prednisone or Cellcept or Enbrel, and you've said, gosh, the symptoms I'm getting from the medication are many times worse than the symptoms of the disease process. So what gives? What am I going to do different? Right? That's the question you're going to have to start asking. What are you going to do different today and tomorrow so that in a week and in a month and a year, you don't have more of those issues? Then the only way that you're going to do that is if you find these root causes. The only way that you're going to change your life is if you partner with someone who actually cares about you, is passionate about your issues, has done this thousands of times before, and can show you. This is not about belief. This is not about you trusting me. We trust, but we verify. And in my practice at Dr. Autoimmune, we pledge to our clients that within 30 days, you will see symptom relief. Within 4 weeks, when you are doing the things that we've told you to do, that we've led you to do, that we've shown you to do, right? Always lead by example, and we are going to lead by actually showing you what to do. So my practice involves myself. I am the person who organizes, who orchestrates, who educates, and then obviously I'm part of the team as far as on the treatment side. We have a clinical nutritionist, and our clinical nutritionist is second to none. She is dedicated, she is educated, and she literally has the experience that I have never even seen before. And that's before she even started working with us. So we have a dream team of people to actually look into what these mechanisms are. What lab tests do you need, right? What lifestyle changes are you going to have to change to get what you want? And whether that be playing with your grandkids, to be able to be around, to be able to be functional, to be able to go on hikes, to enjoy your retirement, to just feel normal like you used to feel. But it's going to mean that you actually have to look at two aspects. The first one is excess. What is an excess in your life? And the second one is deficiency. What are you deficient in? So many people will say, gosh, I'm deficient in iron. I'm deficient in vitamin D. I was told I'm deficient in zinc. And instead of just taking iron, D, and zinc, how about we ask the question, why aren't you absorbing it? Is there a problem with your gallbladder? Are you not absorbing it because of what's happening with your small intestine? Are you utilizing zinc in ways that you weren't designed to do, right? So there are so many of these little detail pieces that are critical as far as how you're going to get yourself back on track. But to get us back on track, right? We know that the vast majority of people that actually have a thyroid diagnosis are actually and truly autoimmune. So the next question has to be, okay, if you want to change your life, how do you even know that you have autoimmunity? Well, again, blood work. And on our labs, every single patient is screened for 2 markers. It's called TPO antibodies, and 2 is anti-thyroglobulin antibodies. That's an enzyme and that's a carrier protein. On top of the TSH, on top of the T4, on top of the T3, on top of the T3 uptake, which actually relates to estrogen. You know what I didn't tell you is that 7 out of 8 who actually get a thyroid diagnosis are female. More than likely, right now, the people that are watching this webinar, they're women. And they are the caretakers. They are the burden bearers. They are the people that are unfortunately left behind and thought of last, many times because you're not thinking of yourself first. And I challenge you today to start thinking of yourself first. To start having that conversation with your spouse and other important people in your life about how do I put myself first? And especially as it relates to your children, because when your children see that you start prioritizing your health and there's nothing more important than your health, guess what they're going to do? They start doing the same thing because we learn by modeling. It's all trial and error. We call them actually mirror neurons. But what that happens and what that means is that your emphasis and your priority on fixing your issues and changing your lifestyle will not only allow you to change your symptoms, the fatigue and the brain fog and the joint pain, right? Into the optimal, vibrant, and thriving health that you're actually looking for. So first, right, we want to know, well, again, how do we know that we have this thyroid issue going on? There's a TSH, T4, T3. We run T3 uptake, and we run these 2 antibodies. So from there, the bigger question is that if what we're really talking about, right, is inflammation, and really inflammation and this topic called leaky gut are intimately connected. So what I mean by that is that leaky gut or intestinal permeability, that we know from the research that's been done on celiac disease, is the mechanism for every autoimmune disease. There are 100 known autoimmune conditions, okay? Every single one of those autoimmune conditions are connected to inflammation and leaky gut. But what I want to show you is that based on the symptoms that you have and based on the lab tests that you have, you can start to understand through education, through us showing you, these are the spokes on the wheel that are driving the leaky gut, that are driving the inflammation and that are causing the symptoms. Because here's the deal. When you talk to your doctor about that thyroid medication and you ask them, how long do I take this, doc? They're going to say, the rest of your life. And I know that it's not fair, but regardless, move beyond that. Start getting a root cause mindset of what actually is causing this in the first place. And what that means is that where is the inflammation coming from? Why do I have this in the first place? That's what I want to talk about next. And of course, eventually we're going to talk about what we do in the practice and how we can help to change your life. And so stick with me as we go through this. I'm going to try to explain this as easily and in an easily understandable way so you can digest this and really start to actually hopefully think in a different way as well. First of all, what about diet? What about diet? Well, diet is everything. Essentially, your biochemistry, your genetics, right? Your physiology is expressed as a result of a high quality diet. So those little sidebars, those little excursions, sometimes those eating out, right? Or sometimes the family gatherings, or maybe it's just every single day if we're eating cheap, refined, processed, we call it highly palatable foods, packaged, right? Then what happens is we drive inflammation. At the forefront of that is gluten. And there is, again, potential for gluten to be in the diet, but what I'm going to tell you with my experience is the vast majority of people actually don't have celiac disease. They have something called non-celiac wheat sensitivity. And what that means is that every single time you consume gluten, that inflammation from that exposure can be lasting 6 months, up to 6 months of inflammation. Boy, that makes you wonder if you should eat those Oreos. Boy, that makes you really wonder, is it worth it ordering that off the menu? And how would you know? You'd run testing. So again, you can run any test here that we're talking about. I'm going to put a red marker, right? So you can, again, you can test, right, for gluten. You can do a non-celiac wheat sensitivity. And you can run a celiac disease test. And we do find people have celiac disease. But the larger issue is that they're reactive to gluten, producing inflammation, causing a breakdown of that barrier. Again, what happens in your gut doesn't stay in your gut. It's not Las Vegas. So guess what? That inflammation seeps out into your body, and gluten can cross-react against the thyroid. Ah, wow. Yeah, hopefully you're, again, starting to understand. This is not just about, oh, I want to be gluten light. I want to be 90% gluten free. No, we need to know if you need to be 100% gluten free. Because what happens is when we actually remove what I call the tax that you're sitting on, okay, the actual root cause mechanisms, the multiple tax that you're sitting on, you're going to see relief. And again, an example of that, as we start talking, this will be more obvious. But just imagine, right? If you're sitting on 3 tax, one of those is gluten. One of those, let's say you have a bacterial overgrowth in your gut. And another one is you've got, again, let's say poor adrenal function, poor cortisol regulation. Well, if you only remove 2 of those, right, and you're still sitting on one of those tax, you're still going to get symptoms. So my job as your provider is to help you understand what are your spokes of the wheel and what are we going to do differently. Are we going to use supplementation? Are we going to use lifestyle? Are we going to use tracking devices like continuous glucose monitors? This is all customized to what you need. And then again, it's not for you to trust us. It's for us to repeat and rerun labs, but it's for you to play ball and actually engage. When you do that, now you have a partnership. Now we have a 2-way street. And now what you can get are the answers you've been looking for and a direct change to your inflammation, a direct improvement in your symptoms. And you won't be the only one that sees it. Your spouse will see it. Your kids will see it so many times. Even yesterday, talking to a patient, she's like, I can't tell you how awesome it is for me to be a full-time nurse, to be dragging as bad as I was dragging, and I have had countless staff members come up to me and say, I'm so excited that you're back. The patients have even come up to us and said, what is she doing different? Because we want what she has. But unfortunately, again, what these patients also want, and we all want, is we want insurance to cover this. You guys, insurance is not going to cover the root cause mechanism because that has no vested interest for pharmacy and for insurance. Insurance wants you to stay in the model. Pharmacy wants you to stay in the model. So our healthcare system is dependent financially on you staying sick. I cannot wait till your labs improve. I cannot wait for you to be thriving. I cannot wait to see the smile on your face on your 2nd or 3rd or 4th visit when you start to realize, gosh, I've lost so much, but I have so much now because you showed me how to get better instead of, again, just gaslighting me or giving me a random supplement or telling me that it's in my head, right? Or sending me to another doctor or just giving up on me. You gotta, again, set your standards higher for your expectations of what you should receive in healthcare. And we want to do that for you at Dr. Autoimmune. So gluten is a big trigger. What about iodine? Well, if you have antibodies against TPO, the rate-limiting Mineral is iodine. So you can actually make yourself worse, and here's the deal. One of the first clients that I ever worked with, I literally made her worse by giving her iodine. And guys, I'll just tell you what, if anything, I am brutally honest. I'm honest with myself as much as I can be, and I want to be honest with you. I made a mistake, and I actually made a patient worse. You know, I took an oath that says do no harm. And I'm serious about that. And it was disturbing and it was upsetting. Because when I was taught in school, it was like, okay, you fix their adrenal glands and you give them iodine, and then maybe you pull them off of gluten, good to go. And that was it. And there's so much more to thyroid conditions. So be very, very careful about iodine consumption, and heavily fortified iodine foods. It may be a trigger to your thyroid, okay? Now, there's another thing called insulin resistance, or we also call it insulin surges. So what happens is if you're fatiguing after meals, craving sugar after meals, shaky, lightheaded, irritable in between meals, what your blood sugar is really doing is it's up and down, up and down, up and down. So what happens, okay, is that, look, you have insulin up here, and look, you have cortisol down here. People with these insulin surges tend to have hormonal problems. Dysregulated menstrual cycles, heavy menstrual cycles. Insulin drives fat cells. Fat cells drive estrogen. So that can look like heavy menstrual cycles. That can look like your mood swings with your second half of your menstrual cycle. That can be cramping, bloating, right? But what do? They want to give you birth control. Hormonal birth control is how they're going to actually fix this problem. And guess what? We know when you have 10 years of birth control, okay, what happens is you increase the chance of hypothyroidism by 400%. A 400% increase in the risk of developing hypothyroidism. That's a problem. I'm not going to get into the mechanisms. I have lots of that content out there as far as why, but you have to understand, for everything that you are taking, there is a potential side effect of what you're going to get. So instead of, again, for me, my recommendation might be, hey, let's measure your insulin on blood testing, because we do that for every single client. And let's see where you're at. Now, on the other side, right, if you've got low blood sugar, now you need cortisol to bring your blood sugar up. Look, that's the shakiness and the irritability and the anxiety. And that is also typically something that disrupts sleeping rhythms at nighttime. Oh, you guys should be having some aha moments here. I really hope you guys are, because this is the point of you spending the time here and understanding that there are mechanisms and root causes behind why you have these issues. And if we change that for you, if we adopt the best diet for you, if we adopt the best supplementation for you, if we track you with labs, right? If we use something like a continuous glucose monitor, that likely will change your life. But this is only if you need it, which is why we do the initial evaluation. We have to know where you're at. What have you done? What's your timeline? When did you first start noticing symptoms, right? And one of the actual huge and critical components of inflammation and leaky gut is something called dysbiosis. Now, dysbiosis, right, is essentially a type of infection. But you're not going to have white blood cells. You're not going to have a fever with dysbiosis. What really happens is you lose control of your immune system, because dysbiosis is essentially good bugs and bad bugs. You got a sandbox in your gut. We call it your microbiome. But it's a microbiome in your lungs. There's a microbiome in your nasal passages. There's a microbiome on your skin. You have more bacterial cells in your body than human cells. You have 10 times the genetic material of bacterial cells than your own genetic material. And that's just what's found in your gut. So 70% of your immune system is in the gut. And so again, what we do is we actually run specialized lab testing. Specifically, this is called the GI map. And we've done others, but this is what we use right now, and it's phenomenal because it's measuring good bacteria, bad bacteria, inflammation markers, enzymes. Because here's the thing, you may just have gas and bloating after meals. You may have diarrhea or constipation. You may have congestion. You wake up congested in the morning, right? You may have rashes all over your body. Or you may just have altered neurotransmitters. You may have chronic joint pain, but that all can be tracked down to this pattern of dysbiosis. And by correcting the microbiome, you are correcting the inflammatory chemicals driving the leaky gut. And we can show you objectively in your labs what's going on. And we can show you how to actually correct that problem in the first place. Is that not exciting? Guys, I'm getting goosebumps. I get tingles when I go through these tests with my clients, when I see the results, and I'm like, I cannot wait to see the changes when we start correcting these problems. Because I know the next time I'm gonna see them, they're gonna be a different person. They're gonna have their life change. They're gonna start to see the light at the end of the tunnel. And you gotta see that light. You gotta start seeing that, because you know at that point when you start to see change, all the other providers that you went to, all the other times that things got missed, well, you know what? Maybe that was just going on the whole time. And no one actually addressed the root cause that was causing the systemic inflammatory problem. So what else causes problems? Okay? The environment. Right? And the number one issue in the environment is mold. Now, mold is a tricky subject because, again, most providers don't know how to identify it. It's not just respiratory conditions that again, mold will cause. It actually can impair your hormones. It can disrupt your gut barrier, right? It can actually, again, facilitate inflammation and leaky gut. It does a number on people. But again, if you're not asking the questions about could you have that as an exposure, you're not going to get the right testing, you're not going to get the right management, and as a result, you're not going to fix your symptoms. I want your symptoms to move on. I want the condition of what's causing the thyroid problem to move on. I want you to have abundance in your life. But if you don't start looking at this as a holistic issue, you miss out on the opportunity to actually, again, move on and have the abundance in your life. So another one, right, is cortisol. Okay? So for all my type A's out there, right, for all my people dealing with sleeping at nighttime, hard to get to sleep, getting a second wind at nighttime, for all my people that are feeling beat up in the morning or walking into a room, forgetting why you walked into the room, right? So many of these symptoms can actually be tied back to your cortisol rhythm. And that's your stress hormone. Now, we all have stress, but it's how we adapt to stress. And guess what? Cortisol can lead to dysbiosis. Cortisol issues can lead to insulin resistance. So these systems are influencing other systems. And so again, it's not about a blood test. It's about a saliva or urinary test to look at, right, the 4 measures of cortisol during the day. And whether your cortisol's low or your cortisol's high, we individualize the recommendations that you need. Again, test, please, don't guess. So the bottom line here is that when you start to understand your physiology, your biochemistry, and the mechanisms underneath, you start to develop a custom plan that is unique to you. We don't have a thyroid protocol in our practice. It would be more convenient. It would probably be easier, and we might even make more money. But the reality is we would not be getting the results that we get. And just bear with me for another 30 seconds before I wrap up here. We're almost done with this lecture. But I just want to read this because we have literally hundreds of testimonials, but this is a special one. And this is a woman that we were working with last year. In fact, just last month, we have four new testimonials of people with thyroid disease. But I want to read this one from last year. It goes, and this is, by the way, this is public. This is actually published right now on Google Maps. Hi, my name is Colleen, and I've been struggling with autoimmunity for over 20 years. 20 years. I think the last count I had 7 autoimmune diseases, including Hashimoto's, Crohn's, colitis, ankylosing spondylitis, and on. I think it all began in 1995 with the removal of my gallbladder. Oh my gosh. Does that sound familiar? Then in 2015, you had She had thyroid removed due to thyroid cancer. I have done tons of research on all of my symptoms, and I always felt overwhelmed of where to start. Yes, I felt exactly like that. I would get started on a new diet or a new supplement and try that for a while, and that didn't work, so I'd move on to the next. It was just a never-ending process. In 2022, so I apologize, a couple years ago, she stumbled upon TikTok, and it was at that point that I saw Dr. Autoimmune and his TikTok lives and videos. Hopefully, when you guys see this, we'll still have TikTok, maybe not. It was like God took me specifically to his page one day. I watched his information for quite some time, did my own research, that's very important. And it was then that all the pieces fell into place for me. I had been to over 60 doctors in the last 20 years, and nobody gave me any kind of information like he was giving on his videos. He was such a wealth of knowledge, and his passion to help people came through loud and clear. Guys, if anything, if you don't think I'm passionate, gosh, I don't know who you think is passionate. Because again, I want you guys to feel that passion, especially when we get into that Zoom visit, eye to eye, and we can start talking about the issues in the tissues. Okay? So I watched this information, I was nervous but hopeful when I set my appointment with him. I was never skeptical. I guess I finally decided that I was worth the time and money to feel human again. Something I haven't felt in quite some time. I had always cared for others, but never myself because there was no time left at the end of the day. I have now been working with Dr. Autoimmune and his team along with his nutritionist, who is awesome, since May. And in those few months, my labs and symptoms have drastically improved. My anti-nuclear antibodies test is negative for the first time in over 20 years. My insulin has gone down. All of my inflammation markers have decreased, and I am feeling so much better. This is all to Dr. Ian, Stevie, and myself for changing my diet, taking supplements, removing the foods that were inflammatory, and taking the time that my body needs to heal. Dr. Ian and his staff are so easy to work with. They are very caring, down to earth, very knowledgeable in autoimmunity, and I highly recommend Dr. Ian, Dr. Autoimmune, and his team. If you're ready to take the next steps to put your issues into remission and live life again, they are an amazing blessing. So that was special. It was long, but I'm just telling you guys, that is the routine. Right now, like I said, we have 30 days to get you results. You need to start with a new patient evaluation. You need to, again, reach out to us and let us know that you're ready to have your life change. You want to have your hand held in a very positive and affirming way with the reinforcement of scientific labs that show you whether you're doing and your investment is actually working. Because we want you to get to a place where you're managing this on your own. And when you do that, you are going to be hopefully one of these people. They're going to write a testimonial and be so excited to tell people about functional medicine and how it changed your life. And here's the thing. The only way that you're going to do this is that you have a reason why. If you know why you want to get better, if it's your grandkids, if it's your children, if it's your spouse, if it's the fact that you just want to live your life again, we can show you how. But I can't do anything for you until you're ready to take that next step. So the next step is going to be a discovery call. From there, we get you set up with a new patient evaluation. We test over 85 blood markers. We come back, I will review all your paperwork and your blood work, and then at that time, I'll let you know if we can accept your case, what exactly has to be done, what your costs are, and what is it going to look like for you as you take your first steps into optimal health. Again, my name is Dr. Ian, and of course, this has been another fun-filled webinar with Dr. Autoimmune. I wish you the best along your journey, and we will be here to support you the entire way. And until next time, again, let your health soar.